for the bicep. So that's the radial tuberosity or bicipital tuberosity. Radial heads up top, ulnar heads down at the bottom. They both have styloid processes at the bottom, styloid processes. In real life, there's actually a meniscus between the ulnar and the wrist, a little tiny disc, a little meniscus. And now we got the carpal bones. Carpal bones are really not difficult if you use a silly mnemonic, another silly mnemonic I have. All right, so you have 2 rows of 4. And we're starting from the thumb side or the radial side. Whichever way you look at it, from the back or from the anterior, posterior. You're starting from the radial side with the first row. So you do the first row of 4 across, and then it comes back and does the second row of 4 across. The first bone is sometimes called navicula in anatomy. The term navicula and scaphoid are interchangeable. Those are 2 interchangeable words. They mean the same thing. Navicula, scaphoid, same, right? So let's do this silly mnemonic. This is how I remember it. I'll name the bones first, and then I'll do the mnemonic. That's better. So you have navicula, lunate, triquetrium, and then on these models, for the most part, the pisiform is attached because it's hard to separate it and put a string through it. They always fall off or something. So that pisiform is actually showing it as attached, but it's not in real life, right? So navicula, lunate, triquetrium, and pisiform. The pisiform is like a ball peen hammer or a P at the very end of your hand, like a hammer, boom, boom. And then the next row is trapezium, trapezoid, capitate, and hamate. And if you notice on the ventral side, there's a hook of the hamate. Okay? The biggest bone in the middle is the capitate. And then the lunate has a half-shaped moon right around the top of it. That's your, I'm sorry, not the lunate, the scaphoid or navicula kind of comes halfway around it. And then the lunate is the same thing. It's going to shape, wraps around both of them. So to name them, there's a silly mnemonic. I did not make it up, okay? So don't blame me. And you didn't hear from me. Never lower Tilly's pants trying to caress her. Silly, right? Never lower Tilly's pants. So navicula, lunate, triquetrium, pisiform. Never lower Tilly's pants. And then go back over again. Trying to caress her. Trapezium, trapezoid, capitate, hamate. Okay, so here's the difficult thing I found as a student and as a teacher. How do you remember trapezium from trapezoid? It's like, what the heck? For me, if you saw a trapeze, it would be hanging off of something, right? The trapeze hangs off a trapezoid-shaped fulcrum, right? So you have to make some sort of stand for it to hold it up, right? So the trapeze hangs off the trapezoid. That's how I remember. So the trapeze is on the edge that you could grab and reach for it, right? The trapezoid is holding it. That's how I remember that. And then the capitate is the central biggest bone that's on the second row, right in the middle. And then the hamate has a hook on the ventral side. It's got a little hook. It's so important. You know how important this is? For me, when I went to school, chiropractic school, semester 1, 21 credits, but one of the courses are pretty easy. It's called palpation. And what you do, the first part of the class, you're stretching. Stretch your hands, you stretch them, loosen them up, stretching our hands. We're spending most of the beginning of the class warming up, stretching our hands, and then practicing to accentuate different points of the hand to use for adjusting. So the pisiform is on the edge. It's like a little, that's a very important part. As a matter of fact, you adjust the atlas. B.J. Palmer used to use the pisiform, get right on the atlas, and then toggle it into my mom next to him, and the chair's crooked, right? And I keep telling him, you got to change the chair. It's throwing your pelvis out. His pelvis goes out of alignment. So I don't put him in side posture. He's had like aneurysms. He's had fempop repair. he's a mess. I'm not going to be bending him and twisting him too much. And he doesn't like the little clicker. He wants to get a good adjustment. He likes a good adjustment. So I lay him face down. I know that this is out of alignment. I take the hook of my hammock and just pop it into position. It pops right into position. Very gentle. And he gets up. He goes, it popped. It popped. You know, he gets up. Because, you know, he's 86 years old. You know, things don't move too well on that age. So the hook of the hamate is, you can find the hook of the hamate on the ventral side. Right? All right, so those are your carpal bones. Then you have your metacarpals. And the metacarpals are the next bones in the row, and they're named just 1 through 5. Roman numeral 1, 2, 3, 4, and 5. 1 would be on the what side? The thumb side. The thumb side. Thumb is called pollicus or pollux. Pollux. Okay, and then the first finger is indices or index. And the last one sometimes is represented as digiti minimi. But you could say first, second, third.